So the next test we're going to look at is hip mobility, looking at internal rotation in prone. Now we can do a gross test first of all, which would be bring your knees together for me, please. Good. And then we can just look to see how much internal rotation she has on one side compared to the other. We can use a goniometer, or the level app, putting it, I like to put it just below the medial malleolus. And internally rotate till I get to a barrier. So she's 45 degrees on this side. I start with the same starting point here. Oops. Get her to 0. And then go this way till I feel her stop. And she's about 46 degrees. That's total range of motion. Now we can do the Craig's test, which would be a better test to know where the starting position of this hip is, looking for anteversion or retroversion. Grossly, greater than 15 degrees would be anteverted, roughly plus or minus. Less than 8 degrees would be retroverted. When we're looking at the Craig's test, we'll zero this out. Palpate the greater trochanter. And rotate till it feels equal on the outside. So she's at about 18 or 19. On this side, start at 0, palpate, good. So on the left side it's interesting because she's about 14, which you would expect a little bit more anteversion given her body type. It's nice to almost do this blindly where you're palpating and looking to see what you feel, because the test itself is feeling the trochanter and seeing where it's equal on both sides in your hand or fingers, and then measuring and doing that on both sides. So grossly, we're looking to see if there's a restriction where she had looked pretty equal, even though I thought there was a slight restriction there. But for very mobile people, if she had a big hip restriction, then I would want to address it. And her bigger restriction was her Faber, not her internal rotation. So what we did was look at functional weight bearing continued through rotation, Faber, Vader, palpation, internal rotation, and then the Craig's test. So those will give you a good idea on what's going on with the hip. We'll do some palpation of the lateral hip in a bit for glute min versus glute med tendinopathy, and then go into the hip bump. But let's start taking a look at some of these tests and see.